Have you ever walked into a room and felt unseen, not because you weren't physically present, but because of the unspoken assumptions tied to your race, your gender, or even the size of your paycheck? That feeling of invisibility, of being misjudged before you've even spoken, is more than just uncomfortable. It is dehumanizing. And for many Black women navigating breast cancer, that invisibility can have life or death consequences. The battle against breast cancer is never just medical, it's layered. And for some women, it means deciding whether to spend money on treatment or food for their families. For others, it means enduring providers who dismiss their pain or assume they don't understand their own bodies. For nearly all, it means carrying the weight of stereotypes about race, gender, worthiness that seep into the way healthcare is delivered. But here's the remarkable truth. In the middle of these disparities, these women find ways to press forward. They draw on belief, resilience, and a kind of courage that reshapes not just their journey through illness, but their identity as warriors. They embody what it means to live at the intersection of race, gender, and health, and still claim agency in spaces not designed for them. And for leaders, their lessons echo loudly. They remind us that resilience isn't just about grit. It's about clarity, courage, and the emotional intelligence to navigate systems stacked against you. Healing isn't just medical. It's emotional, structural, and systemic. This opening rests on the power of emotional self-awareness. To be able to name the pain of being unseen or misjudged is the first step towards reclaiming voice and agency. For leaders, whether in healthcare, education, or corporate life, this is a mirror moment. EI pushes us to acknowledge not only our own blind spots, but also the ways others experience our leadership. Awareness paired with empathy turns invisibility into recognition, and recognition is where healing begins. One of the clearest truths revealed in the stories of these women is that access to healthcare isn't equal. On paper, everyone is entitled to treatment. In practice, the type and quality of treatment you receive often depends on something as simple as and unjust as whether your employer offers comprehensive insurance or not. Women spoke candidly about being forced into impossible decisions. One described delaying treatment because chemotherapy costs would have left her unable to pay her rent. Another admitted she considered rationing her medication so it would last longer because her insurance would not cover a refill for another month. Imagine living with a life-threatening illness and having to count pills like they are coins. That's not just a financial burden, it's an emotional one. A crushing reminder that your survival seems tied to your bank account. And yet, amid these painful realities, women found creative ways to fight back. Some negotiated payment plans, others sought out nonprofit programs that subsidized their medications. Many leaned on families and friends to carry the weight with them. Their resilience showed up not as comfort, but as strategy, a survival skill honed by necessity. Access is more than a card in your wallet. It's the difference between survival and setback. This struggle highlights the need for reality testing. These women didn't have the luxury of denial. They had to make sober assessments of what was possible and what was not. They faced brutal truths and responded with creativity. Leaders must do the same. Acknowledge the constraints you face without surrendering to them. It also reflects self-regard. Believing I am worthy of care is not easy when a system suggests otherwise. Yet that belief is what gives someone the courage to appeal an insurance denial or to keep seeking options. For leaders, self-regard is the foundation of persistence. Without it, setbacks become self-condemnation. With it, they become challenges to overcome. For many women, the intersection of race and healthcare was not subtle. It was glaring. Some were told outright that their pain was exaggerated. Others were met with surprise that they were well informed, as though Black women shouldn't be expected to research or question treatment plans. Still, others experienced delays in being referred to specialists or were excluded from conversations about cutting edge clinical trials. These are not isolated incidents. They reflect long-standing systemic disparities that affect not only survival rates, but also the dignity of the care experience. Being dismissed or patronized sends a message that your life is less valuable, your suffering is less urgent, your survival less likely. And when that message is repeated over and over, it takes an emotional toll as heavy as the disease itself. And yet, here again, women's responses were powerful. Many spoke about becoming their own fire cessed advocates, pushing back against dismissive providers, demanding second opinions, and refusing to allow racial biases to silence them. Their resilience turned inequity into advocacy. Bias in care is not just unethical, it's dangerous. This section shines a light on the absence of empathy in much of healthcare. Too often, providers fail to listen deeply, validate experiences, or recognize the humanity of their patients. For leaders, empathy is not optional. It is the difference between exploitation and empowerment. This also calls for social awareness, a broader EI skill. It is not enough to see each interaction as individual. Leaders must see patterns. When bias is systemic, awareness means stepping back, recognizing those patterns, and addressing them. Ignorance is not neutrality, it's complicity. Being a woman adds yet another layer to the journey. Participants spoke of being labeled as overly emotional when they expressed fear or asked persistent questions. Some described male providers who dismissed their pain or suggested their anxiety was the root of their symptoms. These gendered assumptions didn't just sting, they delayed care, reduced trust, and deepened isolation. And yet many found healing in women-centered spaces. Support groups for women became sanctuaries, safe places to speak openly about fears, side effects, and frustrations without judgment. Female providers often created environments where patients felt heard, validated, and respected. That contrast was striking. Where bias silenced them, community restored their voice. Gender bias silences, but community restores voice. This struggle underscores the value of interpersonal relationships. Support groups, peer mentorship, and empathetic providers created emotional safety nets that strengthen resilience. Leaders must recognize that the relational environment they create is just as important as the technical decisions they make. It also demanded assertiveness, another EI competency. These women had to insist on being heard, often at the risk of being labeled difficult. Leaders, too, must navigate that same balance, advocating for fairness without alienating, speaking truth without silencing others. Assertiveness, when guided by empathy, becomes a tool of justice. Cancer doesn't just attack the body, it drains bank accounts. Women spoke about choosing between paying for childcare and paying for chemotherapy, or deciding whether to buy nutritious food or cover the cost of a copay. For those already living with financial strain, breast cancer amplified every insecurity. But the weight wasn't only material. Financial strain became emotional strain. It introduced shame, worry, and constant anxiety. And that stress was not separate from health. It was directly impacted on their recovery. Women spoke about fatigue worsened by money worries, or stress causing setbacks in their healing. Yet resilience showed up here too. See, many women sought out financial counseling, leaned on community fundraising, or found creative ways to stretch limited resources. Their determination to prioritize survival over shame was a profound act of courage. Financial barriers don't just break budgets, they break spirits until resilience intervenes. This highlights the EI competency of stress tolerance. Financial hardship created a constant undercurrent of stress, but resilience meant finding ways to remain steady under pressure. Leaders can learn here. Stress is unavoidable, but EI equips us to carry it without letting it consume us. It also called for problem solving. Women had to think outside the box, exploring new strategies to make limited resources work. Leaders and organizations face similar challenges: scarcity of time, resources, or funding. But EI problem solving turns constraint into creativity. Perhaps the most telling theme was trust, or more often the lack of. Historical medical exploitation of Black communities was not a distant memory for these women. It shaped their present reality. Distrust in doctors, skepticism about treatments, and hesitation around clinical trials were all rooted in generations of exploitation and dismissal. On top of history, there was the lived present: cultural insensitivity from providers who ignored or dismissed traditional practices. For some women, this dismissal cut deeper than the illness itself because it erased part of who they were. Trust, once broken, became hard to rebuild. But the opposite was also true. When providers demonstrated cultural competence, asking about beliefs, honoring traditions, and listening without judgment, trust blossomed. One woman said, "When my provider acknowledged my cultural background, I felt truly seen." That kind of trust became medicine in itself, strengthening not just adherence, but also hope. Trust isn't automatic. It's built choice by choice, moment by moment. Here we see the importance of emotional expression and flexibility. Trust grows when leaders and providers create safe spaces for people to voice their fears, beliefs, and values without judgment. Flexibility means adapting approaches to honor those differences instead of erasing them. For leaders, trust is not granted by position, it is earned by presence, by adaptability, and by the consistent practice of empathy. Every interaction either builds or breaks trust. And in environments where history has left scars, EI becomes the bridge to healing. The lessons from these women's stories are not meant to stay in the medical world. They are leadership lessons for every space where inequity, bias, or hardship shows up. So here are today's change moves, those practical steps you can take to lead differently, to live differently, and to strengthen your own resilience. Number one, lead with equity, not assumption. Access is not equal. Some of us walk into rooms with health insurance, financial safety nets, or supportive teams. Others walk in already carrying the weight of disadvantage. Don't assume everyone starts from the same place. As a leader, ask, what barriers might be in the way for this person, and how can I help remove them? This calls for reality testing and empathy. Reality testing helps you see beyond assumptions and into the actual circumstances people face. Empathy gives you the sensitivity to notice what someone might not be saying out loud. Equity requires leaders to see clearly and care deeply. Leadership is equity in action, seeing barriers and working to remove them. Number two, practice radical listening. When women's pain was dismissed or their knowledge underestimated, it wasn't just because they lacked voice. It was because others refused to hear. Radical listening means going beyond the words. It means paying attention to the tone, the body language, and unspoken fear. It means believing someone's experience even when it challenges your worldview. This is the practice of empathy and social awareness. Leaders who listen radically don't just gather information, they validate identity, and validation is the soil where trust grows. Radical listening transforms silence into strength. Number three, we have to build communities of voice where gender bias often silences. But women found healing in support groups and communities where their voices were safe and amplified. Leaders must build similar spaces in organizations, those places where people can speak their truth without penalty. Communities of voice don't just reduce isolation, they multiply resilience. This draws on interpersonal relationships and assertion. Strong leaders foster connection, but they also model courage by speaking up against bias themselves. When you normalize honesty and protect it with respect, your team learns that their voices matter. Safe spaces are power spaces where voices find strength. Number four, reframe stress into strategy. Financial strain nearly broke spirits, but many women turned stress into strategy. They did fundraising, negotiating, seeking alternatives. Leaders face stress too. Budgets, staff shortages, deadlines. The difference lies in the response. Do you let stress crush you, or do you reframe it into creative problem solving? This is about stress tolerance and problem solving. Stress tolerance lets you stand steady in the storm. Problem solving helps you chart a path through it. Together, they transform survival into resilience and scarcity into innovation. Stress is real, but strategy turns pressure into progress. Number 5, build trust choice by choice. Trust is fragile. It isn't granted, it's earned, moment by moment. For the women in these stories, trust was shattered when providers ignored culture, dismissed beliefs, or spoke without empathy. But it was built when providers slowed down, asked questions, and honored identity. Leaders must remember every interaction builds or breaks trust. There are no neutral moments. This requires emotional expression and flexibility. Express your care and respect openly. Adapt your approach to fit the person in front of you, not just the rule book in your head. Flexibility doesn't mean compromise on standards. It means honoring humanity in its diversity. Trust is built in moments, lost in seconds, and rebuilt through consistency. Change moves are not about grand gestures. They are about intentional choices rooted in emotional intelligence. They are about how you see people, how you respond to them, and how you create environments where resilience is not just possible, but inevitable. The stories of these Black women navigating breast cancer care and survivorship reveal more than disparities. They reveal a profound truth. Inequities may shape the terrain, but they do not define the journey. These women showed courage in the face of systemic bias, resilience in the presence of financial and emotional strain, and persistence despite barriers designed to hold them back. For leaders, the message is unmistakable. Emotional intelligence is not optional. It is essential. It is the skill set that transforms inequity into advocacy, pain into perseverance, and distrust into determination. Self-awareness helps us recognize where bias or fear may be influencing our responses. Self-reflection gives us steadiness in storms. Reality testing keeps us grounded in facts, even when emotions are high. Motivation drives us to keep pressing forward, even when the finish line feels distant. Self-regard reminds us that we are worthy of dignity, care, and respect. Empathy and social skill build the networks and trust that make resilience sustainable. When leaders apply these competencies, they don't just create better organizations. They create environments where equity can take root, where healing is possible, and where people are truly seen. Resilience is learned at the intersections where identity and equity and self-belief collide. If today's episode resonated with you, share it with someone who needs both awareness and encouragement. And subscribe to Leadership Lessons with Dr. Fredrick Lee II on Apple Podcasts, Spotify, Amazon Music, or directly at leadershiplessons.transistor.fm. Until next time, be aware, be resilient, and lead with emotional intelligence. I'm Dr. Fredrick Lee II, and this has been your leadership lesson in life.